All right, ladies and gentlemen, we're going to get started. We want to be sensitive to your time, which, by the way, we appreciate that you are taking the time and using that to be with us. And we've been working with Cynthia for a while now, and clients have found a lot of value in the information she shares. So I think getting into it, I am Jacqueline Jackson. I am a senior marketing manager at the firm. So I'm going to give you the quick stuff and then we'll get to the meat and potatoes. But obviously, thank you for coming. Quick reminder, if you're not familiar, bathrooms are right outside the door. You want to hang a left and they're right there. And then another thing, just to let you all know, our doors lock at 6, which means they are officially locked. So if you remember something, I need to grab something from my car, I left my cell phone, just let someone from the center know, and then we'll walk downstairs with you so you don't get locked out. Now, one thing I wanted to put out there was how many people work directly with Sandy Adams as an advisor? Okay. All right, so here's this is exactly where I'm going. So the really cool thing about working with the center is that we have a stacked team of specialists. And yes, you work with your individual advisor, but you're also working in partnership with everyone here who's developed some wonderful expertise around financial planning issues. So this is one of the benefits of working with a collaborative team. You get the expertise of everyone. So your team is stacked. And this is particularly, Sandy Adams is someone who has a lot of expertise. I know I had to make this really small because Sandy has so many accolades. It's hard to fit everything in there, but she focuses on aging and longevity, planning for caregivers, and also particularly focusing on issues in terms of death of spouse, divorce, job loss, and other really stressful situations. We know that you need specialized help in those very, very tough transitions, and Sandy is the ideal planner to work with for that. So without further ado, Sandy Adams.
So all I'm here to do really is introduce Cynthia and to let you know that we're going to talk about pre-retirement healthcare tonight. And we know that if you're either retired already or you're planning to retire early, that healthcare or insurance is one of the most important issues that you're facing or that you think about, right? Us, you come to us for financial planning, but one of the things that we're focusing on if you're planning to retire early is how much you're going to have to pay for healthcare, and we try to help you bridge that gap. When it comes to the actual insurance planning part of that, we point you to Cynthia because she knows healthcare and she knows how to help you pick out the right plan and actually help you sign up for that and figure out what's the best plan for you. And then where we come into play is helping you figure out how to pay for that. And then what retirement income sources to use to fund that. Because Cynthia will cover in her presentation, a lot of times picking the right income sources to use during those years can be crucial. And can help you lower your premiums. So we can strategically choose how to lower your income during the years that you're paying for healthcare, free Medicare. We might be able to severely reduce how much we're going to. So I think what we will do is hand the mic over to Cynthia and let her do her presentation. We'll try to hold questions to the end if you can, so she can get through the important information she has, but we will get to all of your questions.
That's great.
Go right ahead.
Well, again, thank you for attending tonight. Thank you for the centers for having me. So just quick on my background. I've been an independent agent for about 28 years now. I told people last week I started when I was 12 because that would make me only 40. But in the event, that would be a lie. So I wish. So I appreciate your coming tonight. I would say in the last 7 of my 28 years, I've really focused in on helping people plan for their healthcare insurance and retirement. So a lot of times that's the Medicare space, but then there are some people, the fortunate people that are retiring prior to 65. So they have, like Sandy said, this gap they need to fill. And so we help those folks as well. And then taking those folks, sometimes transitioning them into Medicare when that day comes, because eventually, you know, it gets here for just about everybody unless we leave the planet, you know, early. But let's see. There we go. Anybody in here already on individual health insurance? Okay, so this is a whole new world. Well, back in 2010, under the Affordable Care Act, there was this marketplace created. Some people know it as healthcare.gov. Some people know it as Obamacare plans. Some people as exchange plans. But basically, it's a shopping enrollment service for medical insurance. But you don't have to use the marketplace. You can, you know, work direct to carriers. But the reason to use the marketplace is if you think you might be eligible for a subsidy, because that's the only way to capture that subsidy is enrolling through the marketplace. A lot of times people think the plans that are on the marketplace are different than off-marketplace plans. There's a lot of duplicity, a lot of the same plans offered in both. So sometimes people ask, well, they'll say, I don't want an Obamacare plan. I'm like, well, it's the same kind of coverage that you can get, you know, directly through the carrier. So there's just, you know, some misconceptions out there about what the exchanges and what the plans are. But it is where you can apply for health, dental coverage. As far as using the marketplace, you can call them up on the phone. 888-318-2596. You can work with an agent. You can go online yourself and do it. So there's a lot of ways that you can enroll in the marketplace plan. We always recommend, you know, using the assistance of an agent or broker, because they're going to know things about plans that might not meet the eye as you're sitting there just, you know, putting things in the cart. So we know some of the ins and outs, little nuances. It doesn't cost any more to work with an agent, so that's always a nice thing too. So Michigan uses the federally facilitated marketplace. So this is, there are some states that have their own state-based exchanges. So we are part of what's called the FFM. In case you're listening in on the webinar and you're in another state, you know, some of this information is going to be different. So who is eligible for a marketplace plan? So basically, just a few things. You have to live in the US. You have to be a US citizen, US national, or lawfully present in the US for the entire time that you plan to have coverage. And you can't be incarcerated. Doesn't look like a problem for any of you here. And believe me, when you do that marketplace application, they ask you several times if you're incarcerated. So not once, but twice, maybe 3 times. So there are basically 4 health plan categories. And they have arranged plans into what they call metal levels. So there are, start the richest. So they're platinum plans that they figure are going to cover about 90% of your health insurance costs. There are no platinum plans available in Michigan anymore. So I don't know about other states, but here in Michigan, they're gone. They just got way too expensive. There's gold level plans that cover on average 80%, silver level on average 70%, bronze 60%. So all these plans will have to have an out-of-pocket maximum, where after you've spent so much for your covered health insurance services, there's a point in time where you're done. So all plans have that out-of-pocket max, regardless of what, you know, category they're in. And we'll go over that in a few slides down a little ways. So this really isn't going to apply to anybody here, but there's also something out there called catastrophic plans. These are for people 30 and under. But in a lot of respects, I feel like pretty much all the plans you can get now are catastrophic. So when someone calls me and they say, I just want catastrophic coverage, it's like, that's pretty much all there is, because on most of these plans, you have to hit a very high deductible before services are covered, unless, you'll look at this in a minute, but unless you are eligible for a subsidy, some people in those subsidy eligibility categories are also eligible for deductible reductions. So it's all income based. So people get into that sweet spot of income where they not only get reduced premiums, but also lower deductibles and out of pockets. So when the Affordable Care Act came out, they decided that all plans had to have a set of essential benefits. And this is good and this is bad. I mean, you can see the list of all the things that have to be included in a plan. Where it's kind of not so good is every plan has to have maternity and newborn. So you're like me, I'm not, you know, that's not going to happen, but I still have to have that coverage. If you're a male, you still have to have that coverage. prior to the Affordable Care Act, you could carve out maternity plans. You could carve out mental health if you didn't think you were going to need that. A lot of them let you carve out prescription drugs, but that's not an option anymore with the Affordable Care Act plans. So let's talk about the subsidies. I already mentioned, but it's really important that they're only available when you enroll through the marketplace. And some people that aren't sure whether or not they're going to be subsidy eligible, maybe they're not sure if they're going to have a large capital gain or something like that. They still might want to enroll through the marketplace, because if you don't, and then you had the lower income, you have no way to retrieve that subsidy. So if you go through the marketplace, you can choose, like you can put in the income you think you're going to have for the year. And you're always basing it on the year of coverage, not a previous year. So when people are enrolling this fall for next year, they have to like guess what their 2024 income is going to be. So if somebody is, not sure if they're going to be subsidy eligible, they can still enroll on the marketplace, pay the full premium. And then if they ended up being subsidy eligible when the year was done, when they file their tax return, they can capture that money back on the tax return. So it would be either credit for against what you owed, or a refund, depending on your situation. So that's a reason to use marketplace if you're not, quite sure. Some people that know there's no way possible that they're going to be eligible for a subsidy based on income, I would say don't go through the marketplace, then go direct to the carrier. The application process is much simpler. You don't keep getting emails every other day from healthcare.gov. And I got people that get onto Medicare 3 years later, they're still getting emails from healthcare.gov. You can opt out, of course, but. So I'm just going to read what I have here. Subsidies may be available to lower the cost of coverage for consumers with certain household incomes. This is important, who aren't eligible for other qualifying coverage, for example, through a job. So I've had people sometimes that they have employer coverage through their spouse, but maybe they're contributing a lot to be on it. And they think that, well, I'll just go on the marketplace and get a subsidy. They're not supposed to do that if they have coverage through a job and it's considered affordable. And there's a calculation to figure out the affordability, but that's something here you got to be careful about. And of course, people that are eligible for Medicare aren't going to be eligible for a subsidy on the marketplace. You don't want to be on the marketplace when you're become eligible for Medicare, because that creates all kinds of problems. So some people, and I'll get that question, they'll be on the marketplace, they'll have a good subsidy and a lower premium, maybe deductible reduction, and they get to Medicare and they're like, I don't want to go on Medicare. I just want to keep my, individual health insurance plan. It's like, well, there's a lot of problems if you do that. First of all, you won't be eligible for the subsidy anymore. And second of all, you decide then down the road, you do need Medicare. There's penalties for not enrolling in Medicare when you're first eligible. And carriers are funny about paying claims if you stay on those individual plans once you become eligible for Medicare. They say, well, Medicare should have been here first and, we'll pay second, but it's just danger zone, okay? Do not tread there. And so prior to the American Rescue Plan Act, which came out because of COVID, subsidies were available for people with projected incomes between 100% and 400% of the federal poverty level. So there was this cliff when someone hit 400%, let's say you're at 399% and you were getting $300 a month off your premium, and you crossed that border, you would have to pay all that back, the 300 a month times 12 months. The way it is now, and this is supposed to be through 2025, and sometimes we see these things continue to get extended once they're in place, but we don't know that yet. But under the American Rescue Act, that subsidy cliff was eliminated, so that tax credits are available even to some people above 400% of poverty level. But it gradually decreases once you cross that 400% as your income rises. So it's not this like cliff, it's just going to be a gradual decrease. So what it really did with the Rescue Act was it made more people eligible for subsidies, and it actually made people eligible for larger subsidies. So we'll see how long. Right now it's extended through 2025. And this is a question that we get a lot. Well, what income is the marketplace looking at to determine whether or not I'm eligible for a subsidy? What exactly? And some people think it's, on your tax return, how there's a line taxable income. It's not that one. So it's actually modified adjusted gross income. And that's not a line item on your tax return. It's a combination of several different lines. But so that would be your adjusted gross income. Plus, if you have any tax exempt income, Non-taxable social security benefits get included in. I think I said tax exempt interest. And I might have this one, untaxed foreign income. So that's what they're looking at. So you don't get to take off that, you know how you get that itemized deduction, that doesn't get to come off for subsidy purposes. So you gotta be a little careful about, you know, what income you're actually looking at. And we help people with that. I think the planners help people with that area as well. So reconciliation, and because I said, I'm gonna jump back a little bit here, you have to project what your income's gonna be for the year you're applying. It's not always possible to like really nail it right on the head. So, you know, people take capital gains that didn't know they're gonna get, things happen. But a reconciliation does take place when you file that year's tax return. So let's say in 2024, you took a subsidy and you said you were gonna make 50,000, and then you ended up making 60,000. When you file your tax return, they'll want the difference back between what you would have been eligible for at 60,000 versus what you took at 50,000. So you're just paying the difference back. There's no penalty, there's no interest. So we always advise people, you know, get as close as possible, but know that there will be a reconciliation. Now, the reverse of what I said, if you overestimated your income on that marketplace application and you came in under that, you will get money back when you file your taxes. And there is, I don't have really a slide on this, but there is a form that you or your CPA needs to fill out if you take a subsidy. It's a separate form that goes with the tax return, taking care of that reconciliation. If you don't do the reconciliation and you want to keep getting subsidies down the road, they won't be able to. So you have to file your taxes. Also, if you are married and you're getting a sign on the marketplace for a subsidy, you have to file your taxes jointly. So there's a part of the application where it tells you must file a joint tax return. And I think for the most part, you know, most married people are filing joint, not all. So that's why I mentioned that. So a few minutes ago, I mentioned that some people are also eligible for deductible reductions. So that's called cost sharing reductions. And that is if your household income is between 100 and 250% of the federal poverty level. So not only do you get a premium tax credit, but you get deductible reductions. Now, to get those deductible reductions, you have to enroll in a silver level plan. They're not available in any other category. I would say, you know, most people these days are enrolling in bronze plans. However, people that are eligible for the cost sharing reductions, most of those will go towards the silver to get the lower deductibles. And we're going to look at some of those numbers in a minute. But the thing is with bronze and silver plans is the deductibles are a little bit lower on the silver plans, but you're still paying co-insurance after deductible, maybe 20, maybe 30%, to an out-of-pocket max of this year. A lot of the plans are $9,100, where the bronze plan might just have that $9,100 deductible up front. So if you have like a serious situation, or maybe not even serious, but just a big medical claim, on a silver plan, you're likely to get up to that 9,000 and change anyway. So people have, gotten smart. They're like, well, let's go with the lower premiums because if something big happens, I'm probably going to get up to that high number anyway out of pocket. But certainly a reason to go with silver would be someone who's eligible for the cost sharing reduction. And this is where we're going to take a look at this land of healthcare.gov. Let's see. So now I need to go backwards. Oh, this one. That one. And actually down here somewhere there should be, do you know how I get to the like Google Chrome? I like that. Hit escape maybe?
Yeah.
No, thank you.
Yeah.
I am not a tech person. So healthcare.gov, that's the site. You gotta be careful on this site though. I've had some people that they'll call me after they've started it and they thought they were just looking at plan prices, but they were actually filling out applications. And I had like a couple people that put 0 for income because they just wanted to see the full prices. Well, then what happened is they got sent off to Medicaid. And then it's hard to undo that Medicaid. Once that application's been sent, it's hard to undo that. So you got to be kind of careful. So I don't want the open enrollment stuff. I want, and they changed the site pretty often, need coverage now. So, and you know, I have a slide on this in a minute, but the annual enrollment period to when anybody can enroll in a plan is November 1st through January 15th. If they enroll between November 1st and December 15th, you get a January 1st effective date. If you wait till December 16th, between then and January 15th, you get a February 1st effective date. But there are situations where people can apply throughout the year. They're called special enrollment periods. So maybe you're losing job coverage. So that would be a special enrollment period where you don't have to wait till the fall. You've got 60 days from that loss of coverage. Maybe sometimes maybe you get divorced and you're, you know, losing the coverage that you had through your spouse. So there are different qualifying life events that enable somebody to get a plan outside of the enrollment period. Also, maybe somebody's took COBRA and now they're at the end of their COBRA. That's a special enrollment period. What you can't do is if you start COBRA, say you started in September and you get an 18-month, most people, there's exceptions, but most people get 18 months of COBRA. So you start COBRA, let's say September, and the next June you decide, I want to get off COBRA and go on an individual health plan. That's not a qualifying event, voluntarily leaving COBRA. You either have to enroll during the annual open enrollment period or wait till the COBRA is exhausted. So you used up the entire term. So got to be a little careful there. All right, let's see. We'll just use my zip code. There, now y'all know where I live. Yeah. Check first, don't do apply now. And let's see. Some of these I'm just working my way through to get to where I can show you plans and rates. Okay, and so I'm just going to pick that I lost qualifying health coverage. And here's another one that gets some people is, and especially with this, and this I'm sure is not going to apply to you guys, but with the Medicaid unwinding that's going on, if somebody loses their Medicaid because they're no longer eligible, they get a 90-day special enrollment period. Used to be 60, but they temporarily made it 90. But I have had people that have come to me in the past that Medicaid sends out these redetermination letters. So you have to like continue to show that you qualify, and they just ignored them. And then Medicaid canceled them. That's not a qualifying event to get an individual plan. You have to be involuntarily canceled from Medicaid. So basically you have to have filled out that questionnaire and they have to come back and say, you're no longer eligible. Then you get a special enrollment period. But let's just say I did the job loss. When you're in the open enrollment period, you don't have to do any of these things. I mean, this is just because it's not November 1st yet. Okay. Don't do that. Don't start or update an application. So preview 2023 plans. That's what you want to do. Just window shop. At least initially, right? Then they make you put your zip code in again. So let's see, tell us about your household. So we start there, and I'm going to say that there's 2 people in the household. So you and other people. Are you married? Yes. Okay. Include anyone you'll claim as a dependent in 2023. So let's say there's no children, there's no dependents. So we're going to say, no, we're not claiming a dependent. And tell us about yourself, age. So I'm going to say 63. And if any of these apply to you, you have to check on like Medicare, legal parent or guardian of a child under 19, pregnant, tobacco user. Does say optional though. But I'm going to say none of these. But I'll show you why you would want to pick this one in a minute. Okay, I didn't do something. Oh, didn't I put that in?
No.
I thought I did. That was weird. Oh, I see. Went to the next page. We're going to edit this, make female 62. Here we go. Yep, that looks better. Okay, so these are the people in the household that are looking to get coverage. Let's play with some different numbers here. So let's say let's just pick 50,000 of income. And this is where Sandy was saying, you know, sometimes people are able to pull money out of different buckets, like qualified versus non-qualified. So taxable income versus non-taxable income to get to that like sweet spot. So at 50,000 of income, this couple would be eligible for $1,205 a month in premium tax credit. Couple little, and I keep throwing in these little hints along the way, but if you are enrolling as a couple, you want to put the younger person first. Because when you get to Medicare, it's easier to remove the older person than to have to, basically they cancel out both and they re-enroll the other. So just keep in mind, younger person is the best one to be primary insured when you're dealing with the healthcare market. Even off marketplace, it's easier that way to take somebody off when they're going on Medicare and leave the one person on versus if that person's the primary and then you got to kind of redo everything. So, and I just say that because a lot of times people tend to put the oldest person first. That's kind of, you know, human nature, I think. Let's look at some plans and then we're going to go back and play with these numbers a little bit. So you got to be careful with plans on the marketplace. Some of them are like very narrow network plans. Some of them are like, okay, you have to use Beaumont doctors only, Beaumont hospitals. So that's where like working with an agent, not like to help you navigate all this, but you know, just picking coverage that's actually going to work for you. I would say like this Ascension is going to be a very narrow network, but zero premium for someone that's in that 50,000. High deductible. $10,000, that's for the family. But I'm going to go down to a plan that has like a decent sized network. We're going to go away. See, this one's St. John only. But all these are zero premiums based on that 50,000 of income. Yeah, I'm going to go up here for a minute and just filter a bit. This is another area to be careful. So it says add doctors, facilities. So people will put their doctors in and then it'll show you which plans they participate with, which would seem like a really nice thing, except for we find there's a lot of errors on who they show participate and who actually does. So that's where looking at the carrier, like we always have asked our clients' doctors, we check the carrier sites specific, Blue Cross, Priority, HAP, to see if those doctors, because I'm telling you, there's been a lot of times where this data has not been accurate. And it could be that maybe the doctor leaves a plan and I don't know how long it takes healthcare.gov to get updated with that, but the carrier sites get updated very quickly. So a little hint there. And so I was going up to filter when I digressed. We're going to add some filters and look at I'll show you the scariest ones. Blue Cross, just because the rates are so high. So the only PPO plan available on the marketplace is Blue Cross, right? Off market, you have Blue Cross and HAP. They both offer PPOs. Other than that, it's all HMO. So it's a very narrow, you know, selection in the PPO world. And people used to be drawn to the Blue Cross PPO because, I don't know, it was back prior to 2018. If you were outside of Michigan, you could use PPO Blue Cross providers in other states. So there was reciprocity of the network and still be in network. Now the way it is with Blue Cross PPO is if you're outside of Michigan and you see a Blue Cross provider, you can, but you get the out of network level of benefits unless it's an emergency or urgent care. So I'm talking life-threatening emergencies. You don't go to the emergency room when the urgent care will do kind of thing. So that is kind of different with Blue Cross and not in group health plans, but in the individual world. So there's not that ease of use, you know, nationally, other than for the emergencies. But apply filters. So look at this one. Family deductible is $18,200, so it's $9,100 per person. And I honestly don't like the way they put this because it makes you think you have to make the whole $18,200 before one person's covered. It's not the case. It's separate, you know, $9,100 each. That's still a very large number though, right? But $430.42 compared to a plan we saw, you know, zero premium plans we saw a minute ago in the HMO world. So yeah, Blue Cross PPO has gotten kind of expensive. And there's less and less enrollment in the individual world all the time in Blue Cross PPO. just a few little hints. Are you guys familiar with HMOs at all? Sort of. So with an HMO, you need to pick a primary care physician. With a PPO, you don't. So you could basically go to any, internal medicine or family doctor in the network any day you can get an appointment. With an HMO, you do need to designate a primary care physician. And with some HMOs, like with Blue Care Network, so that's Blue Cross's sister, Blue Care Network, you need to get referrals from that primary care physician to see specialists, right? Other HMOs, like say Priority Health is a very large carrier, the usual in Michigan now. The Priority Health and HAP HMO, you don't need to get the referrals from that primary care physician to see specialists. So their HMOs are a little more user-friendly. If you want U of M in your network, Priority Health is not best. They do have the hospital, but in order to see their specialist, you have to go through a referral process. And it's new with them. I'm not sure how user-friendly that would be. Blue Care Network, they have a preferred genre of doctors where you can have access to U of M. The app has U of M. So there's just different things like that we, that's a question I always ask people, is U of M important to you? And I sidetrack myself a lot, but I think of these things. So another couple hints. If you wanted a plan that gave you a PPO network nationally, Priority Health has it's called their travel plan, and it gives you the Cigna network outside of Michigan. It's pretty expensive, but for those people who want coverage throughout the US, that's a plan that would give it to you. Another thing they do that is unique to them is if you have and I don't know if any of you do, but if you say you had a child in college and they're out of state, Priority Health will let them have the Cigna network outside of Michigan on any of their plans. So it doesn't have to be the travel plan. You have to provide proof of, where they're going to school and things like that, but another little, tip there. But let's go back and look at, I want to edit the income. See if it'll let me without. Go back here, preview. And once again, code. Oh, they wouldn't do that. I actually use a different platform as an agent, but this is the one that's available to the consumer. So I'm showing you this one. And anybody want me to check any other ages or incomes? Just, not necessarily you personally, but something you want to see. All right.
I would like to have you run one for a single person.
Yeah. Okay, so we'll do just you. And that's really actually a good thing to do. I'm going to still put like a 62-year-old female. And let these continue. Confirm your household members. Yep. So let's do that same 50,000 of income that we had a minute ago. Still $375 a month. Okay. A few years back, 50,000 usually didn't qualify one for a subsidy. So because of that expansion under the American Rescue Act, now someone in that income level could get that each month. If we go, let's go back a bit. I did this just this morning with someone. I wonder if I can hit the back browser. So here's a sweet spot, I believe. Yeah, so at 28,000 in income, not only does it, obviously the subsidy is going to go way up, but you also get these, your deductibles reduced, so the cost sharing reductions. And again, you have to pick a silver plan. Let's take a look at what that looks like. So someone in that income range could pick up a bronze plan for 0 premium. There's a lot of them there. Lots of 0 premium plans. Got to be careful, like local HMO, Blue Cross, that's a very small network. A lot of these initial plans are going to be smaller networks. And they're cheaper because of that. I'll go in a bit of ways here. So now we're seeing a deductible slightly smaller. you know, they were 9,100 a minute ago. But this is what I'm talking about. You still have that out-of-pocket max on the back end. Because after deductible, there's co-insurance. I'm looking for like a kind of a larger, this is pretty popular, the Blue Cross Select genre. Again, if you're willing to work with your primary care to get referrals to see specialists, they're pretty competitively priced in the select world. So there's 4 Blue Care Network networks. There's the network. There's the local network, which is the smallest. There's Metro Detroit, which is the second smallest. And then they have the select. The largest is the preferred. However, the select and the preferred have all the same specialists. So the select just has fewer primary care physicians. So if your doctor participates with the select network, your primary care, there's no reason to pay more for the preferred network because you're going to get the same specialists. But let's look at some silver plans just to show you what that income did to these types of deductibles. We're going to just so this plan that would normally have, and they don't have it listed here, normally would have about a $6,000 deductible, brings it down. I honestly thought it was going to bring the deductible lower than that, but I guess we have to be lower than 28,000 in income to do that. So let's go back here for a second. And let's try 25,000. It's amazing sometimes what just like 1,000 or 2 difference it'll make in the cost sharing reductions. And this is all based not only by income, but also your zip code, your area. So it's different from one area to the next. But look at that, how now it brought the deductible at 25,000 of income down to 1,800. So yeah, again, some people again are able to structure their income and take advantages of, you know, cost sharing with the plans. And so let's see, what else can we look at here? Well, I just want to kind of show you what happens to a subsidy when one person goes off for Medicare, because they're still looking at household income when one person goes off. So if we go back and back and back. All right, tell us about yourself. I think I have to go back one more. Yep, you and other people. Well, do you guys remember when I had a 63 and a 62-year-old, and I think I used 50,000 of income? Wasn't it about a $1,200 premium tax credit? All right, so now we're going to do you and other people, but we're going to go, yep, you're married. No dependents. Now we're going to say, okay, we're going to leave the 62-year-old female. But for this person, we're going to say now they're 65 and they're on Medicare. So we're going to check this. This is where you definitely want to check eligible for Medicare. Continue. Confirm. 50,000. Continue. So that premium tax credit went, remember it was 1,200 or something a minute ago. Now we're down to 491 a month. Now, of course, the premium is going to be less because there's only one person on it, but it does. And sometimes I'll see that where, depending on the income, the one person that's left sometimes has to pay as much as what the 2 people were because of how it affected the subsidy. Sometimes I see very little change. You know, again, it's all based on that income. So if I put normally 100,000 would qualify a couple for premium tax credits still, it'd be small. But that same income, when one person drops off, now there's no more subsidy. So that's an example where someone would end up paying more for one person than they were paying for the 2. Any questions on, you know, we really go into plan specific information one-on-one with clients. It's kind of too much to throw out here tonight.
A question. I'm sorry for the ignorance. We talk about the subsidy. When you say that, are you saying that that's a credit you'll get towards your
Yes.
monthly premiums, or is that your monthly premium?
So when it came up with the subsidy amount, that's the amount that's coming off the premium.
Okay,
And then when you get to that page where it showed the rates,
okay.
that was taking that subsidy into consideration.
Okay.
Well, that's a great question. But let's go back to the presentation. And one of my next slides, I think, talks about, this one, how you can use those premium tax credits. So you have 3 different options. You can take that monthly amount and apply it to the monthly premium to reduce that. So when the carrier sends you a bill, it's going to take that subsidy right off the bill. You could also do a partial amount. So I've had people do the partial amount because they're kind of not sure on their income and they're hoping that they are guessing it right. But just in case they want to take a little lower subsidy and get the money back when they file their tax return, if they ended up being in that space. But if they ended up going over their income, they just got a little bit of buffer there, So that's sometimes, I've never had anybody do this, but when they're eligible for a subsidy, take nothing up front and then just get it all back in the tax return. Haven't had that.
In the beginning, you mentioned the federal poverty level. What is that amount?
Oh, well, I could show that for you. I don't have it memorized, but let's see, 2023. Should I stay signed out or stay signed in? Or stay signed out? Yeah. So it's based on family size. But that is not, I believe that's 100%. Let's look at this one.
Yeah.
That's not like the whole.
It's 2022 and 2020.
Yeah, 2023. These will be the numbers that would put you at the federal poverty level. But if you wanted to see the 400%, is that what you just times these by 4?
I'm curious what it.
Yeah, so you would just times these by, 4 to get the 400%. But yeah, so it's an income range that the government comes up with each year. They decide what it is. Back down here. So I want to just share a little caution. Sometimes people that are not eligible for subsidies, their income's too high. There's no way they can control, get it lower. I've had, like somebody came to me once and their sister had done everything on her own and she enrolled in a plan. She wasn't subsidy eligible on the marketplace that was cheaper off the marketplace. So there are some plans, I'm giving you an example here. Like this year, if you were a 60-year-old female, the Priority Health 5500 off exchange plan would be $724.50 a month. On the marketplace, it's $825.92 a month. So you want to be careful about, So yeah, she enrolled in this and she was paying, and it was a different carrier, different plan, but same situation. So she's paying $100 or more a month than she needed to for the exact same coverage. So that's a caution. And the reason for that is because on those silver plans on the marketplace where you can get the cost sharing reductions, the carrier actually has to, they're coming up with the difference for you. So something that normally would have a $5,500 deductible, which gets down to a $3,000, they're eating the $2,500. So they're going to make it more expensive on the marketplace premium wise to help recoup some of that. So that's where we see this happen, is in the silver level plans. So we talked about the open enrollment period already. It used to just be November 1st to December 15th, but a couple of years back, they extended it, which I kind of think is nice because sometimes if you miss the boat, you get another whole month to, or you could even change your plan. So maybe you pick something that's like found out in January, oh my gosh, I thought my doctor participated and they didn't. Get a little time there to change the plan or change your doctor, one or the other. And I talked about this a little earlier, outside of that open enrollment period, these are the kind of life events that would qualify somebody besides like loss of job coverage, but marriage or divorce, birth or adoption of a child, about loss of employer coverage and exhaustion of COBRA, moving to a new city outside of your old plan's coverage area, and then the involuntary loss of Medicaid. So all the top 4, you get 60 days to enroll. So that's an important window, because if you miss that, you then have to wait till the annual open enrollment period and go without coverage for a while. And then Medicaid, like I said, they've expanded that to 90 days to get enrolled. There is one additional SEP, this special enrollment period. I'm sorry, I speak in acronyms, but there is one additional SEP that's available year round. And that's for somebody who's at the 150% or below poverty level. So those people actually get year round enrollment into plans. At least, right now through 2025. Let's see if they continue that. So this is a hard one to read, but I just wanted to bring up what type of increases we were looking at premiums for next year. So HAP, Alliance Health and Life, wow, almost 15%. Blue Care Network, 5.5%, basically. Blue Cross PPO, 4%. HAP PPO, 12.3%. McLaren, 16.2%. Down here, US Health and Life, they got back into the market, just a year or so ago. It was pretty recent. They had some really competitive rates, but now they've got almost a 20% increase. Priority Health, 5.2%. That, for me, that's the carrier I'm with. I've been with different carriers over time, but that's the one I'm with now. And these are average increases. So that's not what everybody's getting. I got a 9-point-something% increase because I'm older. So I have a $7,200 deductible per person, me and my husband both, and we're up to over $1,500 a month in premium. So we're both still working. We can't make our income lower. It is what it is. So we do not qualify. And I'm like, it's like a mortgage payment at this point, and a $7,200 deductible. But it's like, you got to have it in case something, major happens. But yeah, that's kind of the landscape of what, these increases are looking like next year. Any of you are familiar with HSA plans, health savings accounts? Okay, yeah, they're pretty popular now because it is a way that you can pay for your medical expenses like co-pays and deductibles, maybe dental, vision, with pre-tax dollars instead of after-tax dollars. But they have to be paired with, so it's an HSA savings account. So you have a custodian that has your HSA money, you set up the account. Can't be just any old bank account. It's got to be, set up as an HSA. And then you have to have the health plan that works in conjunction with it. So if a client wants an HSA, we're filtering on HSA plans from the get-go. So we just are only looking at those. Because there are some plans that people think are HSA eligible, like those $9,100 deductible plans. They think, okay, well, those are HSA. No, they're not. They're actually, the deductible's too high to qualify for an HSA. So, and then any plan that offers office visit copays or prescription copays before deductible, they're not HSA plans either. So an HSA plan, the only thing that can be covered before deductible is preventive care. But it is a triple tax advantage because, and I'm going to go over what you can contribute in a minute, but the contributions you make reduce your taxable income. All right, so it's like on line one of your tax return. Money in the account is not taxed, even if it's earning interest or if you have it invested. Some HSA custodians allow for investments, so the earnings are not taxed. And then money taken out of the account is not taxed. So unlike an IRA, when you pull it out, it's going to be taxed. With these, it's not taxed as long as it's being used for qualified medical expenses. We're going to go over some of those. At 65, you can take it out for non-qualified or non-medical expenses. You will pay tax, just like you do on your income, but there's no penalty. Prior to 65, if you pull it out for a non-qualifying medical expense, there's going to be a penalty and taxes. But some of the things that you can, well, I'll get to that in a minute, I guess. Who's eligible for an HSA? Okay, so you have to have an HSA qualified health plan. That's number one. You can't be enrolled in any other type of non-HSA coverage, like maybe through a spouse or maybe if you're on Medicare, no HSA. Well, you're not enrolled in Medicare, and you can't be claimed as a dependent. I've got independent. You can't be claimed as a dependent on someone else's tax return. But some of the qualified distributions from an HSA. So, like I said, dental, vision, your medical copays, deductibles. There's like all kinds of items that you can use the dollars for, but you can also use it for certain premiums, long-term care premiums. You can use it for COBRA premiums. Sometimes people that are bridging that space to Medicare, they're pre-65 and they have COBRA available. Sometimes the COBRA premiums are better than the individual health plan premiums. Again, it's going to largely be based on whether or not you're eligible for a subsidy. But I have plenty of people that are using COBRA you know, as a gap. Some people actually plan, I'm gonna work to 63.5, and I got 18 months of COBRA to get me to Medicare at 65. But you can use the HSA dollars for those COBRA premiums. If you are on unemployment compensation, you can use it for your health insurance premiums. And once you get to Medicare, you can use it for Part A. Most people don't have Part A premiums, but you can use it for Part B premiums. Pretty much everybody's gonna have those. Part D premiums, which are prescription drug plans, Advantage plans premiums, but you can't use it for supplement premiums. But just to say, there are things you can use it for once you get to Medicare. I have an HSA, I've funded it for years. I'm not taking money out of it. I'm just keeping it as like kind of a savings for my Medicare B premiums for, you know, hopefully a lot of years. Hopefully they don't change that rule in the meantime. If they do, I guess I'll just take it out for other stuff and pay taxes on it, you know, it's be like an IRA at that point. Let's look at, I think, did I skip a slide? There was one that showed the HSA. It went away. There it is. It's back. I think it was always there, but so in 2023, if you have an HSA account and you're single on the plan, you can contribute up to $3,850 this year. If you're 55 and up, you get to put in an extra $1,000. It's a catch-up provision. Family gets to put in up to $77.50. And again, if one person in that family is over 55, 55 and up, you can put in an additional $1,000, bumping it to $87.50. If you're two people on an HSA plan, couple things here. You could choose to set up two separate HSAs, one in each of your names, because you could then double dip on the $1,000 catch-up provision. You could each put, you know, $38.50 and an additional $1,000. So it's a way you can get an extra $1,000 in there. Most people only have one HSA for the family. If you're doing that, I usually advise, this is kind of the opposite of what I said a minute ago, but that you put it in the older person's name. Because if you're wanting to use those for Medicare premiums, if it's in the younger person's name, you can't use it for the Medicare premiums until they get to Medicare eligibility. So I usually say, put it in the older person's name. And then once they go on Medicare, you can set up your own HSA, and your own HSAs are always individual. So there's one person's name on it, there's a beneficiary. But yeah, that's what I would recommend in that case. And your financial planners are going to have input on that too, whether or not this is a good idea for you guys and how to structure that. But yeah, so to qualify to, and by the way, they tend to every year increase what you can put in the HSA. So next year, the single is $4,150. Still get the $1,000 catch up if you're 55 and up, and the family's going up to $8,300 with potentially another $1,000. To qualify, the deductible, and this is where I was talking about the $9,100 deductibles don't qualify, because the maximum deductible for next year can be only up to only $8,050. So there are plans out there that exceed that. They're not HSA eligible. So ask me we got 3 minutes. Ask me your questions.
We can stay after.
Yeah, I don't expire at 7. Don't turn into a pumpkin. It's a lot of information, and just know that, you know, if you want help, you can reach out to me. My office. Yeah.
Question. I've heard the term COBRA numerous times throughout the years.
Yes.
What exactly, and I understand it's insurance to bridge you if you have a job loss or something, or loss of insurance until you get another plan.
Sure.
So is that exactly what it is? And are they reduced premiums or?
No. So COBRA premiums are the same premium that the employer pays for your coverage, with up to an additional 2% admin fee.
Okay.
So it depends on your situation. Like what I see sometimes is as people get into their late 50s and early 60s, if they're not eligible for a premium tax credit on the marketplace, sometimes COBRA is actually a better way to go.
But it's keeping the insurance
That you have. Yes.
just for an extended period of time, even though
Yes.
you're not, okay.
Correct. It's the exact coverage that you have. If you're going on COBRA in June, anything that you've already met towards your deductible would carry over to that. So yes, it's your exact coverage, just paying the full premium, not what you were contributing as an employee, what the employer pays for it.
Sure.
Yeah. Plus and possibly additional 2%.
If you choose to retire from a company, depends on that company's benefits, if you can continue COBRA coverage?
So the law is if they have 20 or more employees on the payroll, they have to offer you COBRA. They have a couple weeks when to get that information to you. You have 62 days to elect COBRA. COBRA always goes retroactive to the loss of coverage. So if you wait to the 59th day to elect it, it's going to go backwards to the loss of coverage. They won't let you say, I want it the first of the next month. So that's how that works. Marketplace plans only start the first of the month. So that's kind of a tricky area. Sometimes if people are losing employer coverage the 15th of the month. So that, I would walk people through that, what that looks like. There are off marketplace plans like Blue Cross and Priority will let you pick the day of the month. Like if your coverage ends on the 3rd, they'll let you start the 4th, but those are off market. So not subsidized on marketplace. Those will only start the 1st of the month, which I think is stupid. I think the marketplace plans should just be frank, allow you to pick it up once your other coverage ends. I mean, the whole idea of the Affordable Care Act is that people wouldn't go without coverage, right?
Right.
So don't make them wait till the 1st of next month. Because inevitably, that's when something's gonna happen. So, and like I said, we have things we can, we have some workarounds, but yeah, it's always nice if the employer coverage is ending the last day of the month. It makes it a nice transition. These plans starting the 1st of the month, but it doesn't always work out that way. So, yeah, any other questions or thoughts or complaints?
I'm trying to find the page that talked about the qualifying events. So say hypothetically, what if we were to go live in Europe for 6 months? You'd have to probably find some plan over there. Yeah, and upon your return, I'm imagining that would be a qualifying.
Yeah, we had somebody we had to work with that recently, and they had to show, I think their passport stamp
Okay.
that, coming back into the country. And yeah, so I want to say, yeah, no, that was it. I think just a passport stamp. So that's a good question. I know, so here's the thing. Some people will keep their plans when they're going to be gone out of the country. And that's okay as long as your legal resident is still in Michigan.
Okay.
Yeah. So most people usually would tend to keep that coverage because I don't know how easy it is to get coverage in another country as a US citizen. Probably depends on the country. There's some that offer universal health care, and I think even they cover their travelers. And I'm thinking with the one fellow, we did have to show that he had coverage while he was a soccer coach for a professional company. We had to show he had coverage and his passport back into the US. So, yeah. And stuff like that, when that comes up, we're not 100% sure. We're reaching out to the carriers to make sure, because we don't want to mess that up and have somebody leave, drop their insurance, and then not be able to get it when they come back. So those are areas we got to be really careful about. And one thing too, as agents, like you guys can, definitely people can do this on their own. I mean, healthcare.gov, you saw what I did. We do have definitely a higher level of contacts with the insurance companies. So when people have issues, I've got so-and-so at Priority, so-and-so at Blue Cross, so-and-so at HAP, that I can go direct to these people to get resolution, where if you're a member and you're calling, it's just not a fun experience. So that's, I think that's probably, besides just knowing the plans a little more thoroughly, the level of contacts we have with the carrier can be helpful to you if you have a situation.
Your services, do we pay a fee for those services, or
No.
are you funded through I don't mean to say that, how's your source of income?
No, that's a good question. Thank you. Yeah, it's not a hobby yet.
No, I don't.
Then all the people I work with, I have a great client budget. So the answer to that question, which at this point, I almost forgot. The carriers compensate us. So if we enroll you, they give us a commission, and it doesn't cost you any more. So if you went direct to the carrier, the rate would be no different. So yeah, it's just through the carriers, and sometimes there are some plans out here that I'm not licensed with, I don't represent. I just feel like maybe they're too small, and maybe a client will want to go that direction. That's fine. Here's the link, go ahead and enroll. I'm not going to lose any sleep over it. So
and I will give you honest feedback. She honestly does that, if it's the right plan, or if you're currently enrolled in a plan and she's just doing a review and she said you're in the right plan already, even after we've done this review, stay enrolled in that plan. That's what she does. Yeah.
You know, when we do it always works out well when I do what's best for you. I mean, that's
Good business.
yeah. So, any
That's
other-
why we work with her, because she does business the same way we do with that.
And that Medicare space, there's a lot of Part D carriers that don't work with agents, and so we still show our clients all the options. And if it's one that they don't pay us for, we still help them enroll. So it's just, you know, it just goes along with it. Any other questions or?
You mentioned individual plans versus. I've never really thought about those terms. I'm assuming you mean by the individual plan. One of us going to the marketplace and getting a plan upon retirement, whereas a group plan would be a company provided.
Yeah, that's a better way to say it, an employer-sponsored plan. Would be a group plan. Thank you, yeah.
So I just retired from GM. Assuming I stayed with the retiree healthcare plan,
Yeah.
so that would be an individual plan or
Yeah,
is it a group, like a combination of the two?
yeah, kind of. I mean, it's still actually group coverage. It's not based on active employment anymore, but it is still group coverage. And I think based on your years of service, some of those rates are pretty darn good. In that, it depends on I saw the chart, and it kind of depends on how long you were with GM, what year you started working for them.
So I unfortunately was not in the top, the
Okay.
lowest cost.
So are you basically paying the COBRA rates? Is that what it was?
No, you had like, in like over 30 years, you had like a really good rate.
Yep,
And then also you had the choice of like forgetting it, just going to Cobra, right? Taking your chances of whatever. So anybody had that choice of taking Cobra out wherever you fell. And I think the Cobra amount probably also was pertaining to your years of service. So it really was an individual
right.
combination of factors. For me, it is kind of pricey. I had to make a decision quickly. Yeah. And I did work with Jennifer Sinclair from your office. Yeah.
Great.
But I always knew that I could jump out and go to the marketplace too.
Yeah, so an open enrollment period, if that's some switch you wanted to make, November 1st to, January 15th, you can.
Yeah.
Yeah, that would be your window to do so.
So I think the deciding factor, since I didn't have a lot of time, was, maybe if I went to go live in Europe, then I didn't know what I would have to face. So I just decided, okay, never mind. For now, I'm just not gonna look at the
Well, and with
marketplace.
that retiree coverage, you are gonna have, you're gonna honestly have better coverage throughout the country if you're outside of Michigan. You're gonna have an emergency level if you're out of country. You have to usually submit for reimbursement. So
Yeah.
there are benefits to the retiree coverage. I'm sure your deductibles, it depends on your, yeah. And a lot of people that were retiring from GM this year, they got that buyout. So that income, that buyout income took them way past any subsidy eligibility. So I have some people that I told, yeah, just stay on the GM plan. And then when your income is going to be lower in 2024, we're then looking at subsidized plans because now they're not work income, they're just maybe pulling out of some retirement accounts. But yeah, because you got that, that buyout, that really did, which is good.
Yeah.
Which is good. But yeah, it made staying on the GM coverage probably the right thing to do for at least, this year.
That's what I thought.
Yeah, yeah. You told yourself right. Any other questions or? Well, I appreciate I get to the end of the day sometimes and I get a little, so I appreciate your patience with me. I kind of go on rabbit trails and things. Thank you.
A lot of information if you get on your drive home or you get home later and go, oh, I thought of a question because this is a lot of information and you're rehashing things. Please make sure to reach out to either Cynthia directly or contact information's in the presentation or reach out to one of your planners at the center and we'll make sure that your questions get answered. Yeah. Thank you very much for sharing your time and come back.